We're starting in just over 3 minutes. This is Reda Sadki from the Geneva Learning Foundation. I'm here with Charlotte and Mbuh, also from the foundation. We'll have some exciting announcements. We do this about once a month. We really update you, and this time, this is a big one. We're going to announce the next full learning cycle, the next Teach to Reach Connect. There's a number of announcements, especially for immunization professionals, but also potentially for health professionals from other areas. See you in just under 3 minutes. Warm welcome to all those of you who are joining us on a live stream on the Foundation's platform across Facebook, YouTube, Twitter, LinkedIn, wherever you may be. A warm welcome to you, whether it's good morning, good afternoon, or good evening. We have once again, some exciting announcements and some of the details about Teach to Reach Connect, about the next real opportunity to collaborate, to lead, to think with immunization practitioners from all over the world. So stay tuned. We're going to kick off, and first of all, we're going to open with our very own Charlotte Mbuh, who's going to tell you about what is this full learning cycle exactly that we're going to be announcing today. See you very soon, in just about 1 minute.
Hi everyone, I'm Charlotte Mbuh from the Geneva Learning Foundation, and we offer learning science-based opportunities to immunization professionals from around the world. Today, I'd like to talk to you about the full learning cycle process. Immunization professionals face challenges with obtaining optimal immunization performances, and this has been compounded by the COVID-19 pandemic. So members of the scholar community of the Geneva Learning Foundation come together to share ideas on what they are doing on a daily basis to overcome their immunization challenges. Through peer learning exercises, they are able to take the ideas from peers and use them to develop peer-reviewed action plans that they can then implement within their context and in alignment with their immunization program guidelines. The Impact Accelerator is the process in which action plans are taken from paper to implementation. Throughout this process, action plan owners benefit from support and accompaniment from their country scholar groups and from peers as they report regularly on their progress. They are able to get feedback on how they can improve upon the work that they are doing. The results that they obtain and the difference that they make analyzed and interpreted and showcased through events organized by the foundation, such as the IDS Engine Live, during which scholars are able to share the lessons that they learned and the success, and share also their success stories as far as the implementation of their action plans are concerned. It's the opportunity for them to actually throw light on the impact that they are making in their context. I'd like to take this opportunity to invite you to join us for our next live event on one of our social media platforms, so that we'll continue to see and to celebrate the difference that is being made on a daily basis by frontline immunization workers from across the globe. Thank you.
All right, that's a recorded message from our very own Charlotte Mbuh at the Geneva Learning Foundation. I asked her, we're going to share live with you what is coming up, what are the announcements for immunization professionals engaged in the foundation's programs. If you are here with us today, you need to know that you've just connected with an incredible network with almost 40,000 participants as of today, the 4th of June, 2021. You can see some of the connections that were made last year in what we call the COVID-19 Peer Hub. The Geneva Learning Foundation's approach is really to consider that entire continuum from knowledge to impact. And you can see those triangles, those red triangles, that's what Charlotte was talking about, the specific activities in which you can connect and you share and learn with other immunization professionals from all over the world. So that's really what we're going to be talking about today, and just updating everyone who is interested. You can follow this live, or if you're catching up, that is fine as well. We have a special guest who is Barka Tafida Maman. We're going to come to him in a second. And he is the team leader for the alumni of Nigeria. He was very active and continues to be very active, but really since the COVID-19 Peer Hub. I first want to go to Charlotte. Charlotte, we heard you in the message you recorded explaining what is this full learning cycle? How can this help immunization professionals? How are you doing?
I'm doing great, Reda, and it's to me it's a great opportunity to actually be facilitating this full cycle learning process. Having been a scholar myself in the past, and having taken part in the very first Impact Accelerator launch pad of July 2019.
All right, and want to warmly welcome our guest, Barka Tafida Maman. Barka, could you introduce yourself, please?
Oh, wow, thanks very much, Reda. It's good to be part of this great live event. My name is, as displayed, Dr. Barka Tafida Maman. I work with the National Primary Healthcare Development Agency in Nigeria, particularly in the technical support unit, where we provide technical assistance, to the state primary healthcare boards. So basically, that's what I do, and I've been with the Nigerian Scholar team for about a year now, and I must say it's been a great opportunity for me, and also a wonderful moment, and we've had some achievements over the period. Thank you very much.
All right, and just want to take a minute to greet some of the folks, just a few. We are not going to be able to greet everyone who is connecting across LinkedIn, where we have Kabir Issa Ado, who is connecting from, I'm not sure what country you're based in, Kabir. If you could tell us that, that'd be wonderful. Steve Mwangi from Kenya, Emmanuel Musa, colleague from Nigeria, and again, I believe a key member of the alumni team in Nigeria, and then Mavaler Ndege, who sends a wash hands. I haven't quite figured out what wash hands means, but I think it's it's something good. Now, what are we going to be talking about? So we have a point to make about innovation, and this is from the Foundation's research on measuring learning culture and performance. A quick point that should be of interest to immunization professionals, and really an invitation to reflect on what this means for your practice. Second, we're going to be going to Dr. Barka Tafida Maman to discuss really what this upcoming exchange between Pakistan and Nigeria is all about. So we'll be talking about that. Then we're actually going to be sharing with you for the very first time the schedule and the content of the upcoming full learning cycle, an update on Teach to Reach Connect 2, and then a sneak preview. We'll save something for last that no one has seen yet. If you stay all the way to the end, we should be 15, 20, 25 minutes if there are questions. So let's go. Here is then the key point we want to make about innovation. And here you can see in 2020, so this is in March 2020, it's pre-COVID. And that makes it even more interesting because we have the same kind of information or measurement. At the Geneva Learning Foundation, we study learning culture, and learning culture is that combination of sort of activities, ways of thinking and doing at the individual level, at the level of the team, at the level of the organization, at the level of the broader networks, that is going to make the difference in people's capacity to innovate. And you can see actually this is a measurement for 3,830 participants, applicants in the Teach to Reach program that we ran in 2020. You can see who the respondents were. And you can also see that there's one particular area, which is continuous learning, that is significantly lower than the others. And what that means when creating continuous learning opportunities is low is the following. First of all, it means a low ability for immunization staff to experiment, to take risks, a low tolerance for failure. Second means a focus on task completion at the expense of developing capacity for future performance. And then really not adequately encouraging learning or tying it to tangible organizational incentives. And it's really striking because you can see the other dimensions of learning culture are relatively high, relatively in that same domain, and then you've got that continuous learning. Before we go any further, I'd like to ask our guest, Barkat Afida Maman, does this stir any particular reaction, or would you like to comment this particular result from the Foundation's research? All right, let's see if we can unmute Barka. Are you able to speak to us? All right, perhaps not. All right, okay. So we'll come back to you, to you, Barka. Before we announce the full cycle. All right, let me see. Okay, if you can let us know in the chat if you're having problems with the with your microphone. We'll then go to the presentation about the full learning cycle before we come to you as the team leader. Charlotte, are you able to? Are you hearing? Am I missing something? I'm not able to hear Barka.
I'm able to hear you, Reda, and I do hope Barka is also able to hear you, but I'll just try to leave him a message to ensure that he's not having issues with his microphone.
Okay, all right. So then let's dive in, huh? I say let's go into then this full learning cycle. If you were here from the beginning, you heard Charlotte's recap of what it is, and part of the response. Why were we sharing these data points about this creating continuous learning opportunities and its relevance to innovation is to recall actually that in 2020, so it was part of the COVID-19 Peer Hub, we built this sourcing platform for local innovation, really, and in 10 days, I think, more than 1,200 immunization staff, most of them from the subnational levels, but also many from the country, from the national level, contributed, shared ideas and practices that were then used, and we tracked how they were used. We believe this system, built really around the need for COVID recovery, can help address this gap with respect to continuous learning we were just talking about. Now, the main focus is going to be on the inter-country exchange. Charlotte, could you tell us a word about that? And yeah, Barka has confirmed that he's having a problem with his connection. What is this inter-country exchange, and what are alumni of the Foundation's programs from Pakistan and Nigeria going to be doing on the 12th of June exactly?
Okay, thank you, Reda. With the introduction of the COVID-19 vaccine, many many countries have been facing different forms of challenges as far as the COVID-19 vaccine rollout is concerned. So members of our COVID-19 peer hub from different countries, they get to come together to share experiences and to exchange on the lessons they are learning as far as the COVID-19 vaccine introduction is concerned. We were already able to experience or to see two countries, that's Ghana and Cameroon, come together for the Anglophones and share their experiences, DRC and Cote d'Ivoire for the Francophones. So next week we'll be having Pakistan and Nigeria that will be coming together to really showcase the lessons learned, the success stories, and the challenges, mostly reflect and think on how they can actually handle the challenges they are facing as countries as far as the COVID-19 vaccine introduction is concerned, and also get to hands-on feel on the involvement, on the active involvement of peer hub participants in the COVID-19 vaccine rollout.
So Charlotte, I have a question for you. If you're not from Pakistan and Nigeria, how can you benefit from this intercountry exchange and what participants from those countries will be learning from each other?
Okay, so that's a great question, Reda. So if you are not from Nigeria or Pakistan, you still have the opportunity to follow the event via a social media platform. That is Twitter, LinkedIn, YouTube, or Facebook if you are here now. And you are also able to ask your questions directly to the participants from Nigeria and Pakistan to get more light on exactly what they are doing with the COVID-19 vaccine rollout, and how you can actually use that knowledge within your own context to also have a successful vaccine introduction.
All right, wonderful. So now, next up on our agenda after the Intercountry Exchange, and you can write down the dates. Now, the Intercountry Exchange is a monthly event. We're hoping to get Barka back. Okay, he says he is ready. So then let's ask him to... let's ask him to unmute. Let's see if we can get him on the line. All right. And I believe, Charlotte, you are ready to introduce him with respect to the first two questions we had. Can you tell us more about our guest today?
Of course, Reda, we are receiving today, and he said so earlier, Baka Tafida Maman from Nigeria, who works with the National Primary Healthcare Development Agency as a program officer in the Technical Support Unit. That's the MGF-funded unit situated in Planning, Research and Statistics Department. He's also responsible for providing technical assistance to state primary healthcare board. He's a scholar alumni, and he has participated in about 5 scholar courses and exercises. And actually, he is the country team leader for the Nigerian Scholar Alumni Group. All so right. You're welcome, Tafida.
A warm welcome to you. And to kick off, Barka, could you tell us what is your most significant achievement as a country team? So this grouping of people who have completed one or more courses in the scholar programs run by the Geneva Learning Foundation, and who have come together because you wanted to, because you saw a need for and wanted to collaborate together beyond the courses. Can you tell me what is your most significant achievement in your view?
Oh, thank you, Reda. That's a great question. Well, the most significant achievement is also, a bit of a difficult question, but I'd like to say the Teach to Reach conference was one of the most significant achievement for the team. We've had quite a large representation from members of the Nigerian team and other members also from around the world. So we had about 90 members who were able to complete their Teach to Reach projects. So at that conference, there was a good representation. And we also had some sessions where quite a number of the team members, critically shared. They shared the critical areas where they worked, and a lot of questions were asked. And for us, that was quite an achievement for us. And then as a country team, we've done a lot together. We've been able to, have a subcommittee apart from the larger country group. So with that, we're able to, kind of be like just like you do it in a company. So we had a large number of accompanists in that subcommittee, where we had to put a lot of members through in the courses that we've had in the past. So for us, it's a great achievement. A lot of us have gotten our certificates and have been using it. Part of what we've also done is the fact that it wasn't just about the certificates. There were a lot of people who have been able to implement all that has been learned on the Geneva Learning Foundation. So for us, it's really a great outing. And I'd like to say at this point that the Nigerian team actually looks forward, to a great event on the 12th of June, 2021 with our Pakistani counterparts. Thank you.
Wonderful. And now Charlotte has question number 2 for you.
Yes, Tafida, what is the most urgent or critical issue in relation to COVID-19 vaccine introduction in your country? And how do you think your country's alumni can help make a difference as far as this is concerned?
Thank you, Charlotte, for that question. Well, COVID-19, we all know, is a novel disease that came with a lot of critical issues. But Nigeria was able to, get the vaccines, and they were rolled out. The most significant, urgent or critical issue for the team is, the issue of vaccine hesitancy. This is because we are looking at the number of vaccines that have been received, and then we have a very big population in Nigeria. But then we've had a lot of issues, around people getting to be vaccinated. The vaccines have actually been rolled out. We had a lot of centers where the vaccines were given, but we've been having problems with, vaccine hesitancy, people accepting the vaccine. This includes a lot of health workers, because the initial phase of the rollout was meant for the health workers and the senior citizens. But then, from the data that has been analyzed, there are a lot of health workers who are yet to, get to the vaccines. Not because it is not available, but because there are some misinformation or disinformation around the vaccine. However, we are now seeing improvements in the second phase. A lot of people had problems with possible adverse effects. They had a lot of misconceptions about adverse effects that may come up with this vaccine, since it is the first time we're getting it. But now that so many of the health workers have gotten that, and other citizens, we are getting a lot of acceptance from other people who are showing interest in getting the vaccines.
Okay, so thank you, Tafida. I just want to find out from you, how can scholars, Nigerian scholars, make a difference here as far as the COVID-19 vaccine introduction in Nigeria is concerned?
Oh, that's great. For scholars from Nigeria, a lot of us have been involved in all the different pillars, in terms of strategies for the vaccine introduction. One of our scholars has been, at the top of it. We have also a member of the team who is a WHO staff, who has also been active in the planning and introduction of the vaccine. So we have quite a number of scholars, and there's really been a lot of interest around, being part of the vaccine planning, introduction, and even now that we've moved on to the phase 2, we are seeing a lot of interest. So for scholars in Nigeria, we are seeing that a lot of them are learning from we utilized existing structures in the past, the human resources for health, and other pillars like risk communication, micro-planning, and the like. So those were modified specifically for the COVID-19 vaccine and to generate demand. So we've had a lot of scholars who have been involved in all these activities, and there's a lot of interest. And like I said earlier, a lot of them really want to be part of that event. We want to see how it has been done in other countries. Nigeria also is not without challenges, and we would like to know how challenges in other countries like Pakistan, how they've been able to surmount some of those challenges. So our scholars are actually eager to be part of this auspicious event.
Thank you very much for answering our questions, Tavida. Reda, over to you.
Yes, thanks, Charlotte. So we've been joined by Dr. Mohammed Imran Qureshi, who is the team leader for the alumni of the Geneva Learning Foundation's programs in Pakistan. Welcome to you, Imran. We asked your counterpart from Nigeria has already answered the first two questions. What's your most significant achievement as a country team? What's the most urgent or critical issue in relation to COVID-19 vaccine in your country that you face, knowing that the teams will be meeting together on the 12th of June. And this is the first time we've done this with country teams from Pakistan and Nigeria, the first time that actually you expressed an interest in sharing experience between alumni from both countries. What is happening? What are you learning from COVID-19 vaccine introduction? So a warm welcome to you, Imran. Achievement and most urgent or critical issue.
Thank you very much, Reda. First of all, I want to know if I'm loud enough and you are listening me.
Loud and clear.
Thank you very much, Reda. And thanks to my colleague from Nigeria and thanks to the Geneva Learning Foundation. You are absolutely right, sir, that myself and my country colleagues, the scholars from Pakistan, they are eager to have such a session where we could share experiences, country experiences, rather lessons learned for this effective and important rollout of COVID-19 vaccination. So to be very precise and honest regarding the COVID current situation in Pakistan and the response as far as the COVID vaccination is concerned. So if I could say that the biggest achievement in the country of Pakistan, being the fifth largest populous country of the world and surrounded by so many challenging countries who are facing a hard time with regards to the COVID-19. I must say that Pakistan, despite of limited resources, despite of a fragile health system, despite of, you could say, limited human resource and so many limited systems and so many other challenges, Pakistan is somehow, thanks Allah Almighty, that managed to have a minimum, you could say, damage from COVID. And the overall COVID damage in terms of the COVID patients as well as hospitalizations and unfortunately the deaths are not too much in comparison to the neighboring districts, neighboring country, and not only the neighboring country but also to the developed nations of the world, like so many European countries, America. So if we compare Pakistan with those developed nations and with those other mega populous countries of the world, Pakistan has minimum COVID damage in terms of losing the citizens in Pakistan who are expired basically in this COVID situation. And the biggest contribution for against this achievement, you could say, minimizing the damage would be although not like WHO proven strategies, but different countries have used different strategies, planning and policies, especially lockdowns. So there are terminologies related to the lockdown, whether they are like absolute lockdowns or even smart lockdown or even ultra lockdowns. So we have a lot of such new ideas and innovations within the country, whereby they limited the spread of the infection, and they are not only using the big lockdowns, but at the same time they started to having a smarter lockdown approach, which later on also acknowledged and appreciated by WHO that it has given you the results. And Pakistan is a country where the economy is also not too good. So the problem, as far as our decision makers are concerned within the country, they say that at the one end we have to save our people from COVID, but at the same time we have to like save our people from hunger and poverty. So if they might have been saved from COVID by absolute lockdowns, but we may sacrifice precious lives because of hunger and poverty. So that's probably the reason that the country was in consensus to have smarter lockdown approaching and not go for absolute lockdowns.
So Imran, thank
these
you.
are the
Yep.
the things and the challenge. Let me finish the one challenge also. The challenge which is like really important is basically the number of vaccinations with regards to the COVID. Once it comes to the vaccination response, the number of vaccinations somehow are not in a substantial number to be appreciated nationally and globally. Over.
Thank you, Imran. And so we're talking with Dr. Barkat Afida Maman, and we just heard Dr. Mohammed Imran Qureshi. They are the team leaders for the alumni from their respective countries. And on the 12th of June, for the first time ever, the two teams will be meeting to share their experience on COVID-19 vaccine introduction. So I have one final question for you both. Both Pakistan and Nigeria are large, complex, federated countries with some similarities, but also many, many differences. What makes you think you can learn something useful from an exchange between alumni of both countries? Let's hear from Barka first, and then we'll go to Imran.
Oh, thank you, Reda. I think I'm quite interested in this meeting between Pakistan and Nigeria. We, like you said, have a lot of similarities, especially because we've both had the COVID disease, and it's not too much of a problem for us. Why I'm saying that is because compared to other countries around the world, I would say we've not had too many cases. Also, as with respect to the population in Nigeria, about 200 million people. And I also heard Qureshi mention something like that they've had just minimum number of cases associated with COVID-19. So I think these are quite some similarities. What I think scholars can learn from this is we have challenges also associated with the vaccine rollout. These are two countries that are from two different continents. For Nigeria, we have a lot of issues. We have gaps in the budget, especially at the subnational level. We've also had a lot of security challenges, amidst the vaccine rollout. We've also had some issues with vaccine hesitancy, as I mentioned earlier, especially among health workers. Issues around poor network connectivity. There are also issues around data confidentiality, and so we believe there are a lot of success stories, of course, from Nigeria. We also believe there are a lot of success stories from Pakistan, and we believe this experience sharing might help us, tackle some of the challenges that have been faced over here in Nigeria. Perhaps we could also proffer some solutions and also give some strategies that may likely help a country like Pakistan. So for us, it's an interesting networking event, and we really look forward to that event. Thank you.
That's great. Mohammed Imran Qureshi, so team leader for the alumni from Pakistan. Same question. Pakistan and Nigeria are large, complex countries with some similarities, many differences. What makes you think you're going to learn something useful from this inter-country exchange on the 12th of June between alumni of both countries that will actually help COVID-19 vaccine introduction in your country?
Thank you very much, Reda. As Tafida just mentioned, that he's absolutely right. That I also heard from my colleagues that if we had to compare our country with any other similar countries, so go for Nigeria. So I believe there are a lot of similarities, and Tafida is absolutely right. Whether if you look around the limited number of COVID-19 cases, despite of so many limitations and resource constraints, so that could be one. Nigeria was also one of the country who recently eradicated polio, and Pakistan is still struggling hard to eradicate polio. And being the last few countries of the world, so many things are like planned together, learned together, and executed together. So I believe there are a lot of lessons learned from each and other country to be taken as a way forward, where we could apply those lessons learned in our country context, and can mitigate the challenges and issues faced by the country, whether it is vaccine rollout or whether it is the surveillance. And I believe that the scholar numbers are also too a lot of people always wish to get registered with the Geneva Learning Foundation and accomplish their scholar courses. So the trend is very much on, and this trend is similar in both the countries. And the people are contributing in both the countries, especially if you look around the immunization program. So immunization program is being used in both the countries for the COVID vaccine rollout and also for the surveillance activities. So there are no other health system who is contributing so effectively in terms of COVID surveillance and vaccination response as does EPI program is contributing. So I firmly believe that no country could be exactly similar with the other country, but yes, a lot of similarities are existing between both the countries, and we could have a lesson learned and apply in our country context. So we will be looking forward to the 12th. So thank you very much, Reda, for this wonderful opportunity.
Thank you very much indeed to both of you. So we are honored. It is the country teams that have decided and taken the initiative, country teams from Nigeria and Pakistan respectively. And I believe that both of the country teams have emphasized and really reached out to scholar alumni from India, given the current crisis there, who will be a kind of guests of honor should they choose to join. Again, this is an initiative for members of the COVID-19 Peer Hub. If you're not a member, you will find information on our platforms across YouTube, Facebook, LinkedIn on how you can join this or listen in to this inter-country exchange, whether you are from Nigeria or Pakistan or not. There will be at least one open meeting which will be shared, and then we'll also be sharing insights, release summaries of what was significant that was shared during these times. In fact, I do want to go back to share with you what else is coming up. We've got 12th of June for the Nigeria-Pakistan meeting, but that's far from it. 2 weeks after that, less than 2 weeks, so 13 days after this inter-country exchange, will be Teach to Reach Connect. So this is really a unique opportunity to meet, network, and learn with fellow immunization professionals from all over the world, as you can see here. And really, we have people from all over the world who've joined this Teach to Reach Connect platform. I personally had this amazing time. You click a button and you're connected with an immunization professional from somewhere in the world to have a meaningful exchange and a really kind of particular learning moment. Kicking off from the 25th of June through the summer in at least in Switzerland, in the northern hemisphere, we'll be really calling out to you to share your stories of COVID-19 vaccine introduction, but also of reaching zero-dose children, of tackling inequities in the hard-to-reach areas in fragile contexts, and a few other questions, including COVID-19 vaccine introduction. So we'll be sharing, asking you to share your stories and sharing them with others on the platform through a series of events and other activities. And then the most important announcement, and this is the first time we're sharing this information and making a kind of pre-announcement. There'll be a more formal announcement very soon that we'll be making a Teach to Reach Connect on the 25th of June, and that is the next peer learning exercise. So you can see the little graph here. I don't know if you can see it clearly. Really showed how during during the last peer learning exercise in September 2020. Participants developed, basically generated ideas, shared experience, shared practices. Why? In order to develop action planning for COVID-19 recovery. And these were participants from all over, all parts of the system, from all levels of the health system. And one of the amazing things was the sharing across system levels, in addition to the sharing across borders between countries. So we'll be doing a peer learning exercise that'll kick off on the 6th of September. And you'll be hearing, if you're interested, the best way to find out what's next is actually to join Teach to Reach Connect 2. So this unique opportunity, you can request your invitation now. Sorry, there's a bit of a convoluted procedure to actually access the event, but we're trying to fix that. But that's how it is for now. And again, all of these activities are really on that continuum from knowledge to impact. So how we think about knowledge being necessary but not sufficient, and recognizing the capacity to share ideas and practices with fellow practitioners, and to learn with and from global experts, but also to inform help shape the learning of global experts themselves. You can see the sequence through the peer learning exercise around action planning, going then into the Impact Accelerator focused on implementation. Inter-country peer learning, which we discussed today with our guests, is here. And then the sort of ongoing monitoring and reporting. The whole point is to get to to create a kind of virtuous circle in which immunization professionals from all over the world are continuously supporting each other as they work towards their country's immunization goals. And that's what we wanted to share with you again. Thank you to both our guests as well as to Charlotte and Mbuh. We are way over time, but we had some technical difficulties. That happens sometimes, but thank you for all those of you who joined us across the platforms, and to our two team leaders. We'll see you on the 12th of June, and then for Teach to Reach Connect on the 25th of June, a little bit later in the month. Thank you, and take care. Here we go.
Thank you, Reda, and thank you to the Geneva Learning Foundation.